Hello, my name is Dr. Naomi Dambreville. I am a licensed adult and child clinical psychologist and assistant professor of psychiatry at the Mount Sinai Hospital and Icahn School of Medicine in New York City. It's both not that hard, but also incredibly difficult to have a conversation with another human being perfectly. And so when you're in the role as a clinician, there's a goal here, right? We're providing some treatment intervention, trying to gather some data. But we still want the conversation to be productive and useful for both the patient and the goal of the meeting, right? So I think when thinking about how to have conversations with patients with a diverse range of backgrounds, really is to try to understand how these identities, whether it's race, ethnicity, religion, gender, nationality, whatever it might be, intersect and impact how one experiences their mental health and feel psychologically safe and in their lived experience. And so it's easy to kind of misstep, misspeak, and make mistakes when we're having these conversations just with one another in life. But even as professionals, we don't always know what to say or how to say it exactly perfectly. I would say that one of the most common um, mistakes, or not even mistake, it's just a communication misstep, is leading with assumptions or really not asking enough questions. I think first and foremost, having a productive conversation where we can discuss identity and diversity is about having curiosity and cultural humility, and not assuming that we are both the expert in the room simply because we are, the title of the professional, or have the credentials, because everyone is the expert in their own lived experience, but also just to ask more questions. Sometimes we don't ask enough questions. We don't understand why we don't ask about like why that matters to you. How is this important to you? How does this look like in your everyday life? And that is often where the miscommunications occur. It depends, right? If it's someone you're meeting for the first, time or just getting to know each other, that of course is going to feel a little different than someone you have been working with for a while or have an established relationship with. But again, leading with curiosity. So it's about asking questions, not to just gather the facts. But it's also all right to be upfront. Hey, I'm here to ask you some questions. I want to know more about your religion. How do you identify? What's your background? So being very direct and asking quite simple, non kind of judgmental or loaded questions when we're kind of interviewing patients or just having a discussion with them. And when we're getting responses, is not to just, again, think of them as like, great, I got that. This person is, Christian, this person is European, whatever it might be, but to actually kind of listen and think about it as a learning experience. And that requires a clinician to be open, to self-reflect, and to challenge yourself to kind of sit with what you're hearing. Maybe you understand it, maybe you don't. Sit in the power dynamic also, whether that's because you're sitting with someone with a different identity as you, because even in the same identity, right, it doesn't mean it's the same exact lived experience or understanding. But to sort of remember that we're not just clinician and patient, but we're just kind of people in this world working to better understand someone's experience. And so I think always asking questions, asking almost another question before making an assumption, because we want to sort of understand, and to be able to explain that process to the patient, like making it collaborative, I think can help ease those worries. I'm asking you about your race, or I'm asking you specifically about, you said that you are Black. Can you tell me like what exactly that means? Does your family come from a particular part of the world? Is there something about immigration experience or something? Because what we're trying to understand, and again, this doesn't have to be a secret with your patient. I want to know how you experience distress. I want to understand how your family views this. I want to understand, how help and support is offered or not offered, and if that's influenced by some of these identities that we have and that we're raised in. We also want to think about um, having these conversations, not to just identify and understand the patient's concern or the, treatment goal, or the sort of symptoms or mental illness, but to also understand the factors and structures that support coping and healing and effective intervention. And a lot of the times, those are also going to be found in these identities, right? How does your faith um, serve as a supportive um, tool? And that way you can, remind your patient who's in active distress, like, hey, right, would you like to pray? Can you help someone remind you that you enjoy praying? Would you like to go to church? Um, would you like to go and eat your favorite foods because you're feeling lonely? So really trying to remember that we're using this as a process to understand how mental illness and mental healing is informed by our identities and the diversity of those identities.